Okay, so a typical myofunctional therapy program, we need to be able to follow a series of instructions. So usually from 4 and 5 years of age, we're able to listen and follow directions. Sometimes we can have the occasional 3-year-old that we can do some stuff with. They imitate mommy. We can do kind of little things to tap in the mouth and different things to get the tongue to function properly. But usually the minimum age is about 4. Right? What would you say, Brittany? Younger than that is difficult to follow.
Yeah, yeah, I would say definitely. I always tell parents 5 is a good starting age. And like Joanne said, there's some 4-year-olds out there that do fantastic. It also depends, are they just newly 4? Or are they 4.5? So that goes into it. We do some, what we like to call like mini myo work with those younger ones. Like Joanne said, the 3-year-olds, where we can still really start to regain some function back and work on building up those muscles independently, working on the lips, on the tongue, breathing exercises. It's pretty amazing. As long as you are interacting with the kids and you're playing with the kids, they'll go along with it.
So we do Simon Says with them. Sometimes I have one patient that I have to Simon Says every movement, but that's the way he gets engaged. So it's just a matter of keeping their attention span, and getting them engaged in the process.
And I guess on the flip side of this, which we might as well cover, is what is the oldest that we would treat. And we don't have a cap for that. I want to say the oldest that we've treated is like 75 years old. It is never too late.
It's never too late to breathe through your nose, ever.
It's never too late. I mean, I had a 72-year-old that had his tongue released, and it was amazing for him. So any of you watching are in that older population and you think this isn't for you, function can always be improved.
Definitely. And don't forget, as we get older, a lot of times, all of a sudden, our blood pressure is higher. We're starting to get heart disease, diabetes. And a lot of this, believe it or not, is related to your airway. And doctors just give you medication. They don't ever talk about the fact that, okay, are you snoring when you're sleeping? What's going on at night? Are you getting up to go to the bathroom 90 times a night? Like, these things are all signs that stuff is going on. And we don't want to be on 100 medications as we get older, because that makes more work for our liver. So just learning about your health and starting from any age is definitely a positive.